Hi everyone, my name is Melanie Grant, and this is C&M Glass. Today we're covering nervous and endocrine surgeries covered in CPT Coding for our class 2030. We'll be discussing some of the key points for nervous system coding, which include things like location, repairs, pain management, and therapies, and a brief overview of the endocrine system that is by itself separate of other body systems. So let's get started. Let's look first at endocrine. Our endocrine system is a very small section from 6,000 or 60,000 through 6,999. And you'll notice that this is only a couple of pages that cover the thyroid, parathyroid, and adrenal glands. Other glands for the endocrine system will be found under the area in which they are found, such as the male and female reproductive system for genital glands and the nervous system when you're looking at the pituitary or pineal glands. Keep in mind, your endocrine system is what creates your hormones or messages within the body. And so we'll identify there's a problem by looking at laboratory tests and sometimes x-rays to see that something is malfunctioning. Most of the services we do for endocrinology are going to happen through medications that the patient is receiving. Although various conditions may apply where we need to go in and remove part or all of a specific gland in order to help a patient either with, like, say, cancer or a malfunctioning part of the body. And so you'll find that very small section for endocrine, which covers the thyroid gland for incision and excisions, as well as removal, parathyroid, thymus, adrenal, and pancreas, as well as the carotid body. And there's very specifics for laparoscopic as well as excision. So just a couple of them in there to be aware of. For your pineal gland and your pituitary, you'll find them under the nervous system because those are found within the brain. So that's kind of it on endocrine. You'll look at some of the details in the video that we have this week, but being aware of what we're coding when we're in this system is your most important key factor. Being aware to go in other systems for other parts of the endocrine system is also a key factor in identifying where you should be coding. So let's look at the nervous system. This is a big one, guys. The nervous system is composed of everything from your brain and your skull and spine, as well as all of the nerves throughout the body. And so for this reason, location is your first big important thing. When we look at the location within the nervous system coding, we see that the nervous system is separated into three main areas, which are your skull, meninges, and brain, your spine or spinal cord, not to be confused with musculoskeletal issues, and your nerves, which include all the different parts of your nerves, extracranial, peripheral, and autonomic. So depending on where you're at, it's very important to identify the location of the particular condition the patient has and where we are for the procedure itself. In your CPT code book, I have with me a 2019 CPT Professional Edition. You may have a different one, and if you do, that's okay. But in most of your code books, you will